kind of not private, but we're just going to roll with it because you're here, we're here, and we're going to do the best that we can so that we can answer all of your questions. And we will spend some time with you individually if you need it. I know this isn't ideal, but let's get started. So first, we're going to do a little bit of the housekeeping. Typically, we'd ask you to turn your cell phones off and so we could have some quiet without interruption, but we're not going to go there today because that's kind of silly. But your food will be continued to be served, and your waiters are here to make sure that you are well hydrated and well fed throughout this lecture. Now, after the lecture, we will have some door prizes, and the information sheets that you filled out will be drawn, and we'll draw winners from those. So first, what I'm going to go ahead is I'm going to introduce some of the staff that is with us here tonight. So in the back, we have Ashley, raise your hand, and Renee. And in the far back, we have Alexander. I am Dr. Tori Gambacorda, and then my husband is Dr. Michael Gambacorda, and I'll give him a formal introduction in a second. So we are a true family practice. Our sons work with us as well when they're home from college, and they both plan on going into the family business. So during the summer, they come and help out. So if you do come into the clinic, I'm sure you will see all of us there at some point or another. Now, today we're going to discuss about chronic pain integration and the integrative approach, so that we're going to combine some alternative and some mainstream medicine so that you can get the best health care that you can imagine. Now, Dr. Michael Gambacorda is a double board certified physician. He is certified in family medicine as well as chiropractic and rehabilitation. He also has an executive negotiating business degree from Notre Dame University and many certifications from universities such as Tufts Medical School. Now, he is also a published author and has over 20 plus years of experience dealing in patient care. All right, so if everybody would like to have Dr. Michael come up, please give him a warm welcome.
Woo! There we go, that way. Thank you. All right. Everybody hear me okay? Yes? I will stay away from the speaker so we don't get zapped here. Looks like that's happening. All right, let's do this for us. Well, welcome everybody to the Hangout. Who's been to the Hangout before? Anybody? Y'all know it's a fun party, right? I guess next time we should include alcohol. I think that's the only error that we made this round. We'd have too many people, I think. All right, so again, we are the leading integrated medical facility in Myrtle Beach. Integrative medicine is a combination of traditional medical care and alternative health care. So when you combine the two, it provides you with the most wide variety of non-surgical solutions for chronic pain. Who in the room has or knows someone who has chronic problems? Right. I've heard a few of you already today. You have chronic knee pain, back pain, hip pain, etc. All of them. Right. So we are trying to find the best, most effective solutions that help you and don't leave you hurting or with disability afterward, like many surgical options tend to do. So when we look at this, we are a multidisciplinary approach, and we have a number of various services we're going to touch in a moment. Now, before I go into the lecture, you got to meet my wife earlier. This is Dr. Tori. She's not so shabby if you noticed. She's the CEO of the local lab in town called Any Lab Test Now. She's the co-founder of the Spine Center, and she's an expert in functional medicine and lab testing. She's very passionate about women's health, and she's a leader in business and a mentor to many business owners, and particularly women in business in the region. So again, if everybody can give her a shout out and a round of applause, that'd be great. Thank you. Thank you, Grace. Good. So, as you know, chronic pain is a major problem in our country. As we see, it affects more than 50 million people. Most of us have used, I'll make sure this is out of the way here, sorry. I'm tripping on something. Here we go. Most of us have used pain medications to manage these, and it has cost our country over 500 or 600 million, I believe, 600 billion annually is what it says. Nearly 50% of people also with chronic pain suffer from other conditions, as you may know. You get defeated by pain. You have depression, you have anxieties, you have the defeat attitude, which means nothing helps me, right? I hear that every single day I'm in office. Someone says, I've tried everything. I've been to 5 doctors and I've not seen any benefit. So what is it that we do differently is what you're here to explore. And that is something I hope we can explain. Most of the chronic conditions that we do see, I have listed here, but again, those of you in the room may have back pain, knee pain, fasciitis, neuropathy. Does anybody have neuropathy? Mom? Yes, she does. So neuropathy is a condition where the nerves in the back or the nerves in the legs, or hands it could be, are dying or damaged, and you're feeling numbness or tingling all the time. Sometimes it's from a metabolic imbalance, sometimes it's from a nerve injury or nerve damage. It's our job to figure out where it's coming from and try to help you with these things. Degenerative joints, myofasciitis, autoimmune conditions, these are what we see every single day. Obviously, they're all chronic and they're incurable. So what do? We have to find ways to manage them and improve your quality of life without having invasive procedures that will leave you possibly worse off. And that's what we're trying to do. Very traditional pain management. As you see, we typically take oral medications. Anybody take Tylenol every week or every day? Anybody take ibuprofen? Anyone on prescription pain meds or muscle relaxers? Yes. Of course. Yes, Chris. Good. In our clinic, we use all the traditional medications and injectables that maybe many of you have used, including corticosteroids. How many have had rounds of those? Anybody raise their hands? Yes. Keep them coming. Your hip and your back. Everything. That's right. So very commonly, a steroid is used for inflammation, and it does reduce pain a great deal. But what happens if we keep using steroids? Your liver, she said, okay, liver could be damaged. What about the joint? If we get your knee shot every single 3 months, what happens to the knee itself? Steroids, particularly corticosteroids, can cause wear and tear in the soft tissues of the joint. They can cause muscle atrophy and joint damage over time. So it's okay to use them, and most physicians don't use them responsibly, but many of us get stuck where we use them over and over for many years, and it limits our ability to function in that joint and ultimately sets us up for a complete knee surgery. Traditional medicines may not be enough, and as we've said clearly, there is some limitations. Surgery has a very high failure rate and has very long recovery times. Some of us do not have the time to spend an entire year doing rehab after surgery. It's just not feasible for many people.
Did you remember my cards in there?
Integrative approaches includes chiropractic approach, structural corrections when needed, physical, medical, and rehabilitative approach, regenerative medicine. I had heard someone today mention PRP earlier. Someone has said try PRP. Has anyone else tried regenerative treatments, stem cell therapies, or PRP therapies? Nobody? Just one in the back. Okay. Well, it is a newer cutting-edge solution to pain management and recovery. It's a very popular therapy that's being used pretty regularly. Soft wave therapy is a very deep heating ultrasound unit that helps rebuild blood vessels and tissues. It's also a treatment that we do in our clinic. Cold laser therapy and shockwave combined speeds up the healing and recovery and reduces inflammation. Traditional pain management is offered as well. You had mentioned you had disc issues as well. Sure.
Is that anything like cold plunge therapy?
No.
No.
Nope. So she had asked if that's related to a cold plunge. A cold plunge therapy is a tub of ice water that people jump in to reduce inflammation. When we're dealing with cold laser therapy, it's a laser that's used to treat the joints or inside tissues to reduce swelling. So people that have chronic arthritis, it's very hard for them to do therapeutic activity because it often hurts their joint to exercise. So we can access the joint on somebody who can't walk well or can't move well or just had surgery without having to exercise the joint. So dry needling and acupuncture are also used, sometimes to use for pain management purposes. They help isolate pain and reduce pain symptoms. Gel injections. Has anybody had a knee problem that's used gel before? Good. One here, there, good. Couple people. So gel is a very popular product. A lot of people nowadays are using the gel or hyaluronic acid cosmetically. If you've seen very popular trends right now are women filling their lips or their faces with hyaluronic acid. That's a gel they're putting in their lips to make them bigger. That lasts about a year or two, and then their lips look really, really big, and then it fades some. But what happens is it leaves behind collagen, which is a soft connective tissue, and the next time they have to have it filled, they don't have to have as much filled in because they're building up tissue. And that's how this works when you talk about joint care. When we use a gel in a joint, it hydrates the tissue and the cartilage of the joint, and it creates a space in the joint and allows hydration and blood flow back in the joint where previously it was deteriorated. Gel is a very popular and a very safe treatment for knee pain, but it is limited in its effectiveness because it does not last as long as other products, as you may have noticed. It works for about a month or two, maybe 3, and it kind of wears down. The safety features means that it can be utilized over and over again, because it is not like a corticosteroid where it wears down the tissue. So gel would be a better option than a corticosteroid for more long-term chronic pain relief. Those of you that have knee pain, that's probably going to be something you should look into. Stem cell therapy regenerates cartilage and nerves. Very popular right now is stem cell therapy. We do utilize stem cells from umbilical cord blood and cord tissue from laboratories that are FDA approved labs. We get the products from labs and we are able to help inject the hip, the joint, or the spine, or the knee as well. And it improves the way that the joint functions and heals. Exosome therapy. Has anyone heard of exosomes? It's a very odd word, but I'm throwing it out here because I want to see who knows it. Usually once every lecture someone has heard the word exosomes. Exosomes are components or growth factors in stem cells, but they can be isolated and used just to help you repair and improve the tissue quality that you have. Exosomes are more readily accessible, and they are definitely cheaper and easier to use for most of us. So we do use them a lot for a lot of degenerative and osteoarthritic hips, knees, and spines. All right. I played some videos here, but we're not going to be able to do that right now. So we're going to pass that. I'm going to bring this to the slide where we have an opportunity for you guys. This opportunity today is designed to help any of you that are interested in exploring some of your health options. Those of you that want more information about your health condition that you might have, we will be over to your table shortly to chat with you personally and answer any of your questions that you might have personally. However, today we do have an offer with you guys. If you're serious about your health and you want to take advantage of this, I'll have my assistants come around with us today and she'll be able to offer you this opportunity. This opportunity is available for this workshop, for this lecture only. If you're interested, you're going to have to book it here and today. We do not honor this in the office. But as you can see, it is an incredible offer. You have your initial examination, imaging studies and structural analysis, a laboratory and functional laboratory testing can be done, and we're offering a treatment of a soft wave and a laser therapy treatment to you. All of that is a total value of $865, and today it's only $79 to you at this event. We hope you take advantage of that. We'd love to chat with you more about your conditions, and we'll be around shortly to do just that. I do want to thank you for having us out here. It has been a wonderful experience, and we don't want to take up too much of your time. Just remember, chronic pain does not go away on its own. That's why it's chronic. It is incurable at this point, and we do need to find ways to live with it, manage it better. And there has been many, many improvements in that front. We do want you to take action, and we'd love for you to book your appointments with us, so please contact us or one of our staff members. And in just a moment, we're going to draw some door prizes and get you some gifts. You have a question for me? Okay, you got it. And again, thank you guys so very, very much. Please check our websites for more information. There's plenty of websites up there. Yes, ma'am. I'm stuck. Exosomes. They come from stem cells. Yeah. They're from cord tissue most often. Usually tissue. Structural tissue is used to make structural improvements. So when you see a knee that's damaged, the tissue itself is what needs replaced. not fluid. So it's going to be a thicker tissue that replaces tissue. And again, this is our moment to show pictures of our babies. There you go. So we don't quit. We used to show baby pictures, now they're teenagers. So, thank you. Yeah. I need 7.